Well, Peter Carter, the General Secretary of the Royal College of Nursing, who you saw there in Rupert's report, joins me now live from Liverpool. Thank you for joining us this evening, Dr. Carter. Now, look, I am confused, and I think lots of other people are too. What would be wrong with nurses spending a year on the wards doing the basic care work, washing, feeding, cleaning up? What's wrong with that? Why is it so stupid?
Well, first of all, this is not being asked of nurses. What is being asked of are people that want to train as nurses. Before they can go onto a nursing course, they have to spend a year as a healthcare assistant.
But what's wrong with that?
The point is that, well, if you let me finish, Robert Francis did not recommend that in his report, and we do not believe that that will be the solution to what is undoubtedly a problem, that in some areas you do have issues with poor standards of nursing care.
Forgive me for interrupting you, Dr. Carter, but in the Francis report he didn't suggest a year, but he did suggest some experience of that nature for trainee nurses, did he not?
And we do not have a problem with that. And the point is that what Robert Francis said was that when people in their training, as they commence their training, he wanted to see as quickly as possible that they have 3 months hands-on time with patients. Who could possibly disagree with that? We don't disagree with that. And we know that in the current training regime, half of their time is spent with patients. And we want to work with the government on that. Now, out of the blue has come this proposal that people, before they even come into nursing, should spend a whole year working as a healthcare assistant. It's the wrong answer to the wrong question. I understand.
We have got so little time, really, as ever, to discuss this, so I'm going to move you on, if I may. It's about caring, isn't it? What people are really worried about is the lack of compassion. And we did a report on this last week, and I have in front of me, you can't see it, but I've got a pile of 200 emails from ITV viewers who had terrible experiences. We have bedpans unemptied, we have very ill, terminally ill people who didn't get showered, they weren't fed, their water was put out of reach. What has happened to the caring profession, Dr. Carter? That's what people are asking.
Well, first of all, the vast majority of patients in this country still do get very good nursing care, and it's a very good health service. But I fully accept, particularly with the care in older people, we have a major problem. You find wards of 30 or 35 patients and often 4 or 5 staff. Now, you simply do not have the people to go around. And if your cameras want to come into a hospital and talk to these nurses, these are good, decent people trying to do a decent job.
But you know what, Dr. Carter?
No matter how... Well...
Forgive me again, we're out of time, but we're going to do precisely that. I know we don't have enough time. We are taking our cameras into nurses' areas of work. We're going into the wards in the next couple of weeks, and we will report back, and maybe you'll come back and speak to us again after that.
I'd be delighted to do so.
Thank you so much for your time this evening, Dr. Carter.